Good evening. So sorry for that delay in getting started today. Unfortunately, just having a few glitches with the camera settings on here. Let's just adjust it um, so we can actually see a little bit better. So I'm Tony Rutherford, one of the consultants at Care. I'm the medical director of Care Fertility Leads. What we wanted to do today is take you through the tips and tricks and options for your fertility journey to try and provide you with some useful, practical help along the way. So what I will cover in this talk are the basics of human reproduction and how you work. Because if you understand how you work, then you can understand the sort of treatments that we are going to suggest to you to try and make it better. I'm going to talk about the optimal time to start a family. And are there any lifestyle moderations that would enhance the chances of conception? When you do start to try for a family, what to expect? And when should you seek help? And then finally, just a brief review of what treatments are available if you need help in the end. So first of all, let's start with women. The germ cells that are going to form the eggs, and you can see in this picture here, this is what a mature egg looks like. It looks a bit like a fried egg, really, doesn't it, with the yolk in the center? That's the egg cell. The germ cells that are going to make the egg cells start developing in the 3rd week of fetal life. Just think about it. You're about 5 weeks in your mum's tum. And then the germ cells that develop into the egg precursors by 12 weeks gestation, when you're having that your mum's having that very first scan. And then they continue to replicate until about 5 months. In other words, you're about 20 weeks. And at that point, you may have about 7 million eggs. But that's decreased as the egg gets wrapped in some hormone-producing cells called granulosa cells to form what is termed a primordial follicle. And when you're born, you have between 700,000 to 2,000 primordial follicles. Only half of those are left at puberty. In your whole lifetime, you only have the possibility to ovulate 450 mature eggs in your lifetime. And by the menopause, you've got about 1,000 follicles remaining. So you can see there's tremendous natural selection. But I think it's a really good analogy here, and bear this in mind when we start talking about men later, is women are egg warehouses. All the eggs they're ever going to have were made before they were born. And as soon as they are born, that the eggs start leaving the warehouse, such that you leave half before you actually get to puberty. Seems a tremendous waste, doesn't it? Now, if we look at egg development, this is a slice diagram through a human ovary. And I've got a diary here. This was last year's diary, but we need to go back to last year so that the eggs that you are growing now that are available as an antral follicle, from which one will be selected to be released this month, started their development process back in April last year. The first 6 months of egg development, not a lot happens. The hormone producing cells around the egg become square. And then over the next 3 months, there's rapid growth with the hormone producing cells multiplying millions of times and then producing small lakes of hormone rich fluid in which the egg just nestles at one side. These are the antral follicles, and you'll hear us talk to you about your antral follicle count. It's from these follicles, these antral follicles, and you may have 10 to 20 follicles present. It varies, it decreases with age at the beginning of your menstrual cycle. And it's from this 20 that one will go on to be the egg that is released that month. And the egg that goes on to be selected and released that month is responsible, that follicle is responsible for 95% of your circulating hormones that actually thicken the endometrium and then make it, the lining of the womb, then make it an organ which is suitable for an embryo to implant. So what helps to select out of those 20 which follicle is going to grow? It doesn't happen to be it may not contain the best egg, but it's the follicle that's most sensitive to the hormone FSH. Just imagine sitting in front of you, you've got 20 glasses of water at varying levels of fullness. In your hand, you've got 2 pints of the hormone FSH. You pour that FSH evenly through all of those 20 glasses. The one that's closest to being full will overflow first. As soon as it overflows, you stop pouring. All the others that didn't overflow, they weren't selected. So they disappear down the conveyor belt into the dusty bin. Their time has come. So they've waited X number of years to get the opportunity to grow. They've grown for 9 months, but they weren't selected. So they're not used. The one that's been selected will then go on to grow and produce the hormone estrogen. When the estrogen gets really high, it tips the pituitary gland into releasing the second hormone, LH. And LH makes you ovulate. At this stage, the lining of the womb is nice and thick, and it appears what we call trilaminar on your ultrasound scan. And you can see 3 very clear lines. The LH does 2 jobs, this LH surge. It makes you ovulate in about 40 hours, and it matures the eggs. It unleashes a cascade reaction which matures the eggs after, again, a similar sort of 36 to 40 hours. And assuming you're going to just ovulate naturally, the egg is released and it'll be picked up, hopefully, by the fallopian tube, if you look on the image on the right-hand side of your screen. The space that's left behind forms a gland called the corpus luteum. And the corpus luteum produces not only estrogen, but it also includes progesterone. So if estrogen is the builder and builds the lining of the womb, progesterone is the fitter, and it puts the lights on, puts the water in. It makes the endometrium a favorable place for implantation. And the peak progesterone occurs about the time that the embryo, having fertilized in the tube, comes all the way down the tube and into the uterine cavity. So the peak progesterone is when implantation is due to start. What about men? Men, a little bit slower as always to get going. The primordial germ cells that are going to make sperm start about the 3rd week of development. The germ cells in the testis only differentiate into spermatogonia at puberty. So nothing happens until puberty, so 12 to 13. But the difference here is that a man will make sperm for the rest of his life. So he becomes an allergy, a sperm factory. The sperm take around 61 days to make. And if you look at the diagram on the bottom, they've got a tail to move them. They've got a mid piece, which is the engine that provides all the energy. And then they've got a head piece, which includes all the nuclear material here. And this is the testes are made in these structures here called the tubules. And then they go through this very delicate system into the epididymis here, the squiggly bit on the outside of the testis, where they are stored. And then they're pushed from the epididymis into the vas deferens at ejaculation. So the sperm and the volume of sperm is only a small amount, and it makes up the first part of the ejaculate. The rest of the ejaculate is made up from secretions from the seminal vesicles and the prostate. So a normal sperm count, which is on the bottom left-hand side, is a volume of ejaculate of 1.5 mils, a count of over 15 million per mil, and progressive motility of 32%, and which means that they're all moving in the right direction, and normal morphology of 4%. So that's a little bit about eggs and sperm. So what is the right time for you to start a family? Well, I mean, first of all, you're in a relationship. It depends on the type of relationship, how easy it might be to form a family or not. But everything's possible now. It could be you've got a great career and it's trying to find the right time. You know, sitting down with the boss and he's just offered you this fantastic promotion and you're going to go off to work in Paris or Barcelona. And, you know, you're aware on the right-hand side, the fertility clock is ticking in that women have finite fertility. And once you get into your 30s, this clock starts to tick, and particularly late 30s and early 40s, it becomes increasingly important. So it can be a complex situation. Are you in the right relationship? Are you in a relationship? Do you want to be in a relationship to have children? Your career, the aspirations that you have, and that time clock clicking on all the time. So if you actually look at the optimal time to start a family, and you look at the annual fertility rate per 100 women not using contraception, and this is some work that's been around for some time. It's a review from 1986, and you can see that as you get older, in your 20s and early 30s, the pregnancy rate, fertility rate per 100 women is still quite high. But as you get down to 35, 39, 40 to 44, and then 45, the fertility rate is really very low and virtually non-existent. Why does this happen? There's two reasons. Firstly, the number of eggs left in your ovaries is falling all the time. So you may have had 800,000 at the time you're born. You might only have 400,000 by the time you go through puberty. By the time you're 35, you only might have about 35,000 left. And when you go through the menopause, about 1,000. So the number of eggs available to be chosen and selected has decreased. But another really important reason, and one reason which I think stands up more than anything else, is what we call aneuploidy in the embryos. That as you get older, the ability of the eggs to make normal embryos deteriorates. And that's because of this process. When an egg is formed, and when you have that ovulation trigger, it reinitiates the process to get rid of half the female chromosomes, leaving half behind to meet the sperm that's got 23 chromosomes. So the two 23s, one from the egg and one from the sperm, come together to form a new whole. That process of getting rid of those chromosomes is quite a complex process. It needs lots of energy. First of all the chromosomes in the egg are all tangled up. They have to separate out. They all have to come together, a bit like Noah's Ark, 2 by 2. And then they have to separate off. And a little portion of your egg cell is then extruded from the cell, and the other half of the chromosomes are left inside waiting for the sperm. But sometimes that process doesn't go very well. And because it needs a lot of energy, and maybe as you get a bit older, the batteries in the egg cell, the mitochondria, don't work as well. And you might find that when they separate, that they don't align equally. And then when they separate, maybe an extra chromosome's left behind. And the commonest extra chromosome left behind that we've all seen is Down syndrome, that we'll all have heard about. And that's got an extra chromosome 21. But you can have extra chromosomes from all the other chromosomes in the egg cell. So when it meets with the sperm with 23, you might have 47 chromosomes instead of 46, or 45 instead of 46. Either way, that embryo becomes abnormal, and it'll either not implant or miscarry. So you can see that the aneuploidy rate increases with age. So by the time you reach the age of 40, 66% of your embryos will be abnormal. By the time you reach 42, 78% are abnormal. And therefore, your miscarriage rate will increase, and the chance of you getting pregnant and having a healthy baby will fall. So what can you do within your life to get yourself ready to enhance your chances of having a baby? First of all, you need to have a good, high protein, low carb diet, rich in omega-3 fatty acids, which you can get from nice fish like salmon. You have a lot of good plant-based proteins, lots of vitamins and minerals, fresh salads, olive oil, foods, nuts that contain lots of antioxidants. A typical Mediterranean diet. In fact, there's even a cookbook, the Mediterranean cookbook, that's worth looking at. And you don't want a diet which is rich in processed sugars, because that's going to have an impact on your gut. We all have bugs all over our body, and what we eat will determine what our microbiome is, and in a woman that'll determine what the microbiome is going to be like in the vagina and the uterus. And we know that if you don't have the right microbiome, then that can lead to a reduced chance of conception and miscarriage. So myself and some colleagues in Leeds did some work, when we're going back now into the sort of late 90s, where we demonstrated that if you had a common vaginal infection called BV, bacterial vaginosis, which is commonly associated with a fishy smell after sex, that we found that if you had BV, there was an increased risk of early miscarriage. It almost doubled the risk of miscarriage following fertility treatment. If it was slightly abnormal, then there was still a higher risk, but not quite as high a risk of miscarriage. And those are in 771 consecutive IVF cycles. We now can actually look at your endometrial microbiome, and we can assess whether you've got the right concentration of the bug lactobacillus. Lactobacillus is the friendly bug that uses glycogen made by your vaginal wall cells to make lactic acid. That makes the vagina an acidic environment, which protects you and stops potentially pathogenic bugs from growing. And in over 80% of women, that the bacterial flora consists of lactobacillus in over 90%, as high as 99% of bacteria are lactobacillus. However, in some, there are other bugs that grow that don't have this ability to use the glycogen to make lactic acid. So the pH in the vagina falls, and you can get occasionally pathogenic bacteria that get into the endometrial cavity, and they can cause a low-grade chronic inflammation that could reduce the chance of getting pregnant and also increase the risk of miscarriage. You can, as I say, try and protect that by eating a healthy diet. You can actually take some oral lactobacillus, but you can also give some lactobacillus capsules as well into the vagina. And the commonest one that is available in the UK is Canis Flor in terms of the vaginal pessaries. Weight is also important. You can't afford to be too underweight or too overweight. This has a significant impact on your chances of getting pregnant. So you can see, compared to normal, which is below 25, increasing your body mass index will reduce your chances of getting pregnant. Indeed, if your weight BMI is greater than 35, then you reduce your chances by half. It really does make a significant difference. So, and we now know that there is some evidence from animal studies that some of that may be related to infiltration of the egg cells with fatty acids, which can damage the endoplasmic reticulum that make proteins, and the mitochondria that help to make the energy that the eggs need. So you can see how the mechanism whereby fertility can be altered with increasing weight. So there are lots of ways we can help. It's hard to do it on your own, but there are organizations that can help, like Slimming World and Weight Watchers. You can assess your BMI. There's a BMI calculator, and it's different for different racial groups, and you can correct it for that too. That diet alone, using the sort of high protein, low carb diet, will make a significant difference to your fertility. And this is the reason why most health authorities have put a limit on NHS funded treatment at a BMI of 30. What about other things that we all like doing? I'm being a real party pooper here, but what about going out for a pint or having a glass of wine? Well, you can drink, but we do know that the more you drink, the less likely you are to conceive. And also, there is a chance that drinking a lot of alcohol could actually intoxicate, could harm the developing fetus. So it is important. So how much could you drink? Well, you will, your chance of conception if you drink 10 units a week, which is a bottle of wine, are going to be less than if you drank half a bottle or you drink nothing at all. And I think there's always a balance to be had. And I think about half a bottle of wine for a woman is about right. For men, it's usually 3 to 4 units of alcohol a day. So in other words, a couple of pints are probably not going to make that much difference. But if you start to increase, that may start to make a difference to your sperm too. Smoking has an amazing impact on fertility. 20 a day reduces your chances of conception by 25%. Passive smoking is also likely to affect a woman's chance of conception. Men smoking is also associated with reduced semen quality, and you can actually see in embryos from men who smoke that their DNA repair mechanisms are not as healthy. So it's important that you don't smoke. And again, a lot of health authorities don't want you to smoke if you are trying to conceive. Here's a strange one though. What about exercise? And we know that we all want to be fit. Everybody's telling us we want to be fit. But it's the type of fitness that you do. If you do high intensity training for more than 3 hours a week, you're going to reduce your chances of getting pregnant by up to 40%. If you're overweight, that has less effect, but it's still, there's a really quite a large study, 2,232 women who did 4 hours per week of high intensity training and 40% reduction in live birth rate, higher risk of cycle cancellation. But if you're overweight, vigorous exercise can help you lose weight to improve fertility. So it's all about the balance between your weight and your exercise. What about vitamins? What are helpful? Well, I think folic acid and vitamin D, there's a study that came out of Birmingham a few years ago now, which showed that if you were deficient in vitamin D, that had a low chance of success with IVF. If you had enough vitamin D to keep your bones healthy, you got slightly higher success rates. But if you had optimal levels for fertility, it almost doubles the chance of success with IVF. Vitamin D is a very important to take, and that's why we now measure most women's vitamin D levels as they start for their fertility journey. There are some evidence that coenzyme Q10 may be of value too. This is a supplement that works on the mitochondria, the structures that make energies in cells. And there's some evidence that if you take coenzyme Q10, that will improve your embryo quality. And that's been shown in randomized controlled trials. Some women are advised to take DHEA, and there's some small studies that suggest it might be helpful. But again, I think that needs further discussion with your doctors in clinic. For men, vitamin C and E, fresh fruit and vegetables, zinc, selenium, Impril, and Proseed. Somebody's just asked what DHEA is, so I'll answer that question while I'm at it. DHEA is an androgen. It's a male hormone, which is used as a precursor of estrogen. Mindfulness. All of this going on, and you're going to get really stressed. And of course, stress doesn't help you getting pregnant. If you're doing a really busy job at work and your boss is putting so much pressure on you, you've got a lower chance of getting pregnant than if you're in a more calm and relaxed manner. How do I know that? There was a study that came out of Nottingham some years back now, where they looked at the cortisol levels in women's hair, and they found that those that had lots of cortisol in the hair had less chance of conception than those with smaller levels of cortisol. And of course, psychological stress can affect a couple's relationship and libido, and your partner may not be able to maintain an erection. You may not have sex because you're having to have sex because this is the day you need to have sex. So I think mindfulness, ways in which you can try and release your stress levels, are all going to be helpful. And some people find acupuncture helpful and exercise helpful too, as long as it's not too much exercise. But Pilates, yoga, all really good at trying to relax is the wrong word, but be mindful and be calm. How often do you have to have sex? And this is, a difficult question to answer really, because you don't, again, going back to the previous slide, want to increase the stress level so you can't have sex. If you look at the studies, daily sex results in the highest probability of conception. But come on, guys, I mean, that's just not really suitable, possible, for most couples. But sex every 2 or 3 days is likely to maximize your overall chances of conception. And most pregnancies are actually attributed to sex during the 6-day period, starting 5 days before ovulation and including the day of ovulation. And the highest conception rates associated with having sex 2 days before ovulation, which actually, when you think about it, is probably quite sensible, because when your sperm is deposited at the cervix, it's got to swim all the way through the uterus to the end of the fallopian tube, a bit like swimming the length of Windermere. And then when it gets there, it's got to climb Scafell Pike to get into the egg, to be the first one to get into the egg. So it's, it needs a little bit of rest and sustenance on the way. It needs to be in the fallopian tube when the egg's released, as the egg only lives for 12 hours. So you need lots of good, healthy sperm in the end of the fallopian tube. And it's not going to get there if you're having sex and the egg's already been released. What about other lifestyle matters? Well, I think most of these are pretty self-evident, really. Recreational drugs like cannabis can affect sperm. It can affect egg transport and increase the risk of ectopic pregnancy. So you should try and avoid recreational drugs. Men, testicles, they're outside your body for one reason: to keep cool. So don't wrap them in tight underwear, and don't go and sit in a bath for hours or have hot saunas. So use tepid showers, keep the testicles cool. And occupations like being a chef, or perhaps using noxious chemicals without the appropriate safety mask, can also affect sperm. Coffee, well, the occasional cup of coffee is not going to do you any harm. But if you're a coffee fiend and you're drinking 4 or 5 cups an hour, then that likely will have an impact on fertility. And some medicines, bear in mind that some medicines do impair fertility. And one of the more common ones that we used to find with men was sulfasalazine, which was used in the treatment of inflammatory bowel disease. But there are other agents that can affect fertility. And of course, chemotherapy affects fertility as well. And there are particular medications that you may be on for other medical conditions. And if you are thinking about getting pregnant, it's wise to speak to your doctor to make sure that you optimize the medicines you're on so they don't stop you or harm you getting pregnant. So what to expect? Another question that's come up from Poppy is, can you take Q10 through all stages of treatment? The most important part for it is actually during the treatment of the sort of 3 months leading up to those final stages of egg production. So what to expect when you're trying for a baby, when you've decided it's the right time? Don't expect it to occur overnight. The chance of getting pregnant in one cycle in our population is 20 to 25%. We'd expect about 43%. So 43 out of 100 women should be pregnant at 3 months, 65% at 6 months, and 84% at a year. The younger you are, the more likely you are to get pregnant quicker. The older you are, the less likely you are to get pregnant quicker, for the reasons that we explained earlier. And after around about 2 years of trying, we would expect about 94% of couples overall to have conceived. So what's the likelihood of getting pregnant with time? With men, does it make a difference with a man? We've seen the decline in fertility with female age. What about male age? And yes, there is a slight difference. And here you can see that men aged 40 having sex twice per week have a 10% lower cumulative success rate compared with men aged 35 over a period of 24 months. So as you get older, you also, it does affect men, but perhaps less so than women. And here's another one, a slide which illustrates the impact of eggs. Now, this is IVF success rates. And what I wanted to show here in these slides is you can see the live birth rates with IVF falling quite considerably, whether you're doing fresh or frozen, with age. However, if you were to use donor eggs, you would get the same chance of success consistently over time, even in women over 44. In other words, the rate limiting step here is the age of the woman, and that's why it's important to focus on trying to have a family a little younger. So when to seek help? If you're concerned about delays in conception, you should be offered an initial assessment and you should go and speak to your GP. The definition, the WHO definition of infertility is 1 year of unprotected vaginal sex in couples who where there's no obvious fertility factors in either partner. However, if there are known factors like the woman's not having periods, you're older than 36 and time's getting short, you can't have sex because you've got erectile dysfunction, or you know that you've had cancer treatment when you're younger, then, or you've had a bad pelvic infection, then go and be seen by your doctor sooner. Initiate that referral sooner and earlier, because if you need treatment, there's treatments there that will help you get pregnant. So what treatments are available? At Care, we believe in diversity, inclusivity, and the motto is family is for everyone. Whether you're a single woman wishing to have a family together, if you are a homosexual couple, whether that be a lesbian couple, two men, whether that everybody is entitled to have a family, and it's possible to have a family using modern assistant day techniques. We can also help preserve fertility in those couples that one or the other partner is facing cancer treatment too, and then that hopefully provides them with the ability to have a family later in life after they've recovered from their cancer treatment. So what treatments are available? If you don't ovulate, we can give you ovulation induction, some really good fertility agents that can make you ovulate. If you can't have sex, we can give you IUI treatment, intrauterine insemination, where the sperm is placed in the womb cavity. For a lot of couples, IVF and ICSI, if you've been trying for more than 2 years, become the mainstay of fertility treatment. ICSI is used if the sperm count is low. If you are unable to produce sperm for whatever reason, we've got sperm donation. If you need sperm as a lesbian couple, then we can provide sperm. If you need eggs, if you're a male same-sex couple, then we can find donors for you, and then we can find a surrogate to carry that pregnancy. If you were born without a womb, or perhaps you had a womb removed because of cancer, but you still had your ovaries, we can collect your eggs and we can use your partner's sperm to make embryos that could be used in a surrogate. We can preserve fertility for those having cancer by storing sperm or storing mature eggs. And we can also help couples who've got families that may have a genetic condition by, for example, cystic fibrosis, by identifying the abnormality in an embryo and only putting back healthy embryos. So we can help lots and lots of couples have healthy pregnancies together using these modern technologies. This is just an example of taking some cells from an embryo for aneuploidy testing. So you can tell whether the embryo is normal. It's a very clever little technique. Okay. Okay, next slide, please. Thank you. So Care, where are we? We're all over the country. We've now got a clinic in Cardiff, and we've got a clinic in Wales too. So there's clinics all over the country. And there's lots of support organizations here that can help you on your fertility journey. So I hope that this has helped tonight, and I'm happy to take some questions. And if you want to, Chloe can combine the questions, and I'm more than happy to send out answers to those questions if you want. Is it worth males taking B12 supplement? I think it's probably worth people having a healthy diet. I think that's my view on that, unless they do have a tummy problem which would make them less likely to absorb B12.
Lovely. Dr. Rutherford, can you hear me at all?
Age, please. Age. The BMI is 30 for NHS-funded treatment, 35 for self-funded treatments, and age. The NHS normally will only offer treatment above the age of 40 to 42 if you've got evidence of good ovarian reserve, which means that you've got more than 5 antral follicles, you've got an AMH of greater than 5.4 as well. Is it okay to travel on a plane during the first trimester? A lot of people do have to travel, air hostesses, etc. It can muck up your time zones a little bit, but it's still okay. When you do travel, obviously the first 12 weeks of a pregnancy are the time where up to 80% of miscarriages take place, and probably you're at most risk there. And so try to be cautious if you have a history of miscarriage when you're flying. And I think you're dead right. Wear some flight socks and make sure that you move around. And why can't you just take progesterone through your period to support then in preparation for implant going through a treatment? Progesterone on your own is unlikely to make you pregnant. Sometimes additional progesterone may be helpful if you've got a history of miscarriage, particularly if you've been bleeding. But on the whole, progesterone is not really been proven to be a great treatment. 3 failed embryo transfers. I'll start my trip for things. What would you advise to do for any diets of fitness? I think the fitness and the diets are just as I explained. Don't do too much high intensity if you're overweight. If you're the diets are the high protein, low carb, particular emphasis on the probiotics, which may help strengthen your vaginal flora and try and protect the womb cavity. And my AMH is 5.1. Would I need an egg donor? You wouldn't need an egg donor, not necessarily. Age is also important in working out the importance of AMH. So you have to take the whole picture into account when making a decision about what's going to be the best treatment. What are the optimal hormone levels and balance for a woman once she's conceived for proper implantation development to avoid miscarriage? Well, we know, and we're going back now a long way away. So when I started doing medicine, there's a chap working in Bristol called Mike Hull, and he looked at women trying to get pregnant, and he measured their serum progesterone and before they were pregnant, and then looked at the women who did get pregnant, and the serum progesterone level you need is 28.6. So we aim to get our progesterone levels in patients having treatment above 30, but anything above 28.6. And people have repeated that study quite recently with women having egg donation treatment and frozen embryo transfer in Spain. A big study, 1,650 patients. And again, that magical figure of 28 came up. So that's the best way of just checking your hormone levels 7 days before menses or 7 days after ovulation, just to see what your levels are like. Are there any dietary or supplements you'd recommend for someone with PCOS? So I think, again, with polycystic ovaries, try not to over-exercise because you might just tip your periods over. You've already got a pretty sensitive pituitary gland. Again, I think that the high-protein, low-carb diet is best. Bear in mind that a lot of women with polycystic ovaries do have impaired glucose tolerance, don't cope with a high sugar load very well. Myocytol is also helps in women with PCOS at the level of the insulin receptor. So an AMH at 41, Claire, is good. Age is probably more important. I think at the age of 41, you're not going to produce as many eggs. If you want to have a go with your own ovaries, you could give it a try. But I think you need to be conscious of the fact that if it doesn't work, or you may just have to be pragmatic and say, well, my chances of success are going to be a little lower. They'll be higher with egg donation. How am I going to spend my money? What's important for me here? Do I want to have a go with my own eggs? If it doesn't work, go on to do egg donation. I think most people want to do that. But if it's difficult, then and resources are tight, you might wish to go along the egg donation route, which would be more successful. BMI needs to be to commence treatment. Yeah, that's right, Chloe. Can adenomyosis affect ability to conceive in the first place? Adenomyosis is where the lining of the womb grows into the womb. And it's like endometriosis, but in the womb itself. And it can cause heavy and painful periods. There's a lot of stuff here with adenomyosis where people might suspect it on ultrasound scans. But there's many pregnant, post-menopause, post-parous women who've had babies who will have adenomyosis too. You will find it in an increasing proportion of women as they get older. You can get quite gross adenomyosis, which may impair your chances. The doctor might recommend that you go on some form of suppressive treatment for around about 3 months, a bit akin to being endometriosis treatment. But the evidence that this prolonged treatment is helpful is debatable, because it does take 3 months, and it might, that's just delaying matters even further. Is there a supplement to help naturally increase progesterone level? Now, I'm not aware of one. It's a good question, but I'm not aware of one. Okay. Unexplained infertility, an umbrella to diagnose with an undiagnosed. Yes, I think that's right. Unexplained infertility. So going into what we know now, we probably know a little bit more than we did in the early 80s when I was training to do infertility medicine. I started working with Robert Winston in 1985. And we know a little bit more now. We've got AMHs and we've got antral follicle counts. But there's still an awful lot we don't know, and we can't explain. they're poorly explained. Now, sometimes when we look at some couples with poorly explained, they may have a low ovarian reserve for age. So it means that they may not have quite as good a chance of getting pregnant as their peers. So it's not all totally unexplained. Okay. I think every other day sounds better to me, Sinead. I think trying to do sex every day is probably a little bit too much for both partners. But look, it's personal choice, and you know some people do. But the days that you're more likely to get pregnant are the 5 days leading up to ovulation and the day of ovulation. Okay, so I really do hope that this has been helpful, and I'm pleased to tune into more of our Instagram live events. They are, I think, a really good way of giving folk the opportunity to maybe ask that question they felt embarrassed to ask, and to impart some, I think, good basic knowledge. Because it's not just about what treatments you can have, it's about getting yourself into the best possible health to have a baby. So I really hope you enjoyed it. You take care. Bye now.
I'm Shah, and I manage Care's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about Care Pay, our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So, if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose Care was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of a one size fits all, but with Care that didn't seem to be the case at all. They took everything into consideration, and they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you, and fingers crossed, will give you that positive result at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to Care.
Oh, the support at Care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared for by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what care can offer you. To provide you with the best care possible and to give you your best chance of success in treatment, we look to our own care family. From our consultants, embryologists and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, and that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.
Family. It's who we are and who we're always going to be. It's the important little moments, the big emotions, the beating heart at the centre of our world. It's the journey that we take there, together, one step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are care.
My name is Professor Charles Kingsland, and I'm the Group Clinical Director for Care Fertility. At Care, our number one belief is family for everyone, and this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex, we get single patients wanting to start a family, we get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualised treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene, a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that the clinic was only down the road from us. So we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic, and even when I was ringing out with I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way, and I feel like they lived the journey with us.
So I've had several treatments with Care, and I now have a baby, and that's taken a number of treatments, fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.